Hello, my name is Tracie. I work here at the WP Holman Clinic at the Launceston General Hospital. Welcome. Today I'll be showing you around the clinic and the two main treatment areas, chemotherapy and radiation therapy. I'll also introduce you to some of the staff who will care and treat for you. Come with me.
Hi, Trace.
Hi, Carolyn. Hi there. Hello, Melissa.
Hi, Tracy.
This is the Holman Clinic main reception. You've recently been referred to us by either your GP, specialist or surgeon. You and your oncologist have decided that chemotherapy, radiation therapy or a combination of the two are the best form of action for you right now. For your first appointment, you're to report to the main reception. You'll be directed through to the Oncology and Haematology Day Unit where you receive your chemotherapy. Or for other treatment, radiation therapy is in this direction. Okay, come with me. I've got someone I'd like you to meet. And here's just the man I'd like to introduce you to. Good morning, Dr. Gowden.
Good morning, Tracy.
Would you be able to give us an overview of Holman Clinic, please?
I'd be happy to. The Holman Clinic provides a patient-focused, comprehensive, multidisciplinary cancer care service to the population of northern Tasmania. Within this clinic we deliver chemotherapy, radiation therapy, and also we have an active haematology and palliative care service. But it's not all about doctoring. We also have within the clinic lots of allied health professionals that look after the whole care of the patient. In particular, we have social workers, dietitians and chaplains.
What do you take into account when deciding the best treatment options?
That varies from patient to patient. Treatment is individual and really depends on the type of tumour, the stage of the tumour, the age and medical status of the patient, and indeed what the patient wishes in that particular situation.
Do you see patients that receive more than one form of treatment?
Yes, more and more we're using combined treatments, so combined radiation therapy and chemotherapy together, and the two work generally better to improve the outcome.
Do doctors see patients regularly throughout their treatment?
These are intensive courses of treatment, and therefore we regularly see our patients both within chemotherapy and radiation therapy, not just to assess how things are going, also to answer any particular queries the patient or the carers may have.
If a patient has a concern but doesn't have an appointment, how is this best addressed?
The easiest way for that to be addressed is for the patient to contact the radiation therapist or the chemotherapy nurse that's handling their care on that day.
Thank you so much for your time.
That's an absolute pleasure. Have a good weekend.
We're going to head on around to radiation therapy now. Brad's waiting there to show us around. Here comes Brad. Hello, Brad.
Hi, Trace.
Would you like to show us around?
Yeah, sure, I'd love to. We might start at the beginning with the simulation appointment. Come in.
So, Brad, what actually happens at the simulation appointment?
Well, here at the simulation appointment, or the sim as we like to call it, this is what prepares you for your radiotherapy treatment. It forms the basis of all the planning of your treatment, and at this stage we need to make sure that we've got you in a position that's both comfortable and stable for us. We need to make sure that we can reproduce your treatment position each time you come in for your treatment. It can take anywhere from around about half an hour up to an hour.
So I guess the position the patient is in and the equipment used is determined by the area being treated?
That's right. Now we have a number of devices that we can use depending on what area that we are treating to help us make you both comfortable and stable for us. I can show you those now.
Great.
So this, for instance, if we were treating your chest, we need to make sure that your arms are up and out of the way. We'll be supporting your arms here. Your head might be resting in the headrest here, and your hands clasping your wrists up here. To make sure that you're nice and comfortable, we can put a bolster under your knees just to help take the strain off your back. If we're treating your head and neck area or somewhere around there, we can make a mask. And this is tailor-made specifically for you. So this is going to fit you exactly. It helps keep you nice and still for the treatment, but it shouldn't be uncomfortable at all. So once we've determined a nice comfortable position, we'll be drawing some lines on you with an oil-based pencil. It's a blue pencil that can come off quite easily. We also use some permanent markers that are around about the size of a pinhead to help us line you up for the treatment itself. The treatment's personalised for your body and your treatment, so everything is done around you. So what happens next is we do the scan itself. We line you up under the machine, take the scan, and then those scans are then sent up to our planning department for the planning of the treatment itself. That's done by the radiation therapists on a planning computer. The planning itself can be quite complex and could take anything up to a couple of weeks to achieve.
Is there any actual treatment at this simulation visit?
Not at this stage, Tracie, no. All we're doing here is the scanning for the planning of the treatment itself. You might have to wait anything up to a couple of weeks before your treatment starts, depending on the complexity of the plan.
I imagine that this is a good time for the patient to let their radiation therapist know if they're feeling like the position they're in is too uncomfortable.
Well, that's right. It's important that we can make sure you're in a stable position for us, but also a comfortable position for you. So if you're not comfortable, by all means let us know, because it's important that we can reproduce that position each time you come in for your radiotherapy treatment.
Okay, that's sim then. Where does the treatment actually happen?
Well, what happens next is we go to the treatment machine. Follow me and I'll show you.
Great. G'day, Lindy.
Hi, Trace.
Hi, Lindy.
Hi, Brad.
So, Brad, this is the radiation therapy reception area.
That's right. This is where you'll come to check in for your radiation therapy treatment. Here we've got our main waiting room area. Feel free to bring along any of your family and friends if you'd like to. Down here we've got our transit lounge. That's an area where you can make use of if you've got a long distance to travel and you might be waiting around for a long period of time. Over here we've got some tea and coffee facilities with some biscuits as well. Feel free to make use of them if you'd like to.
What about people that need help with transport?
If you've got transport issues, certainly our social work department can help with that sort of area.
After waiting, what happens next?
Once you've been waiting and you've been called for your appointment, one of the radiation therapists will come along and take you to one of the change cubicles and get you to change into a gown.
Are you able to show me that?
Okay, let's have a look.
Great.
So this is our change room, where we'll ask you to change into one of our gowns, just like this one. And we'll also give you a bag that you can put the gown in when you finished your treatment today. When you take it home, just remember to bring it in each time you come in for your treatment. When you're changed, we'll get you to have a seat on our chairs just over here, and when the radiation therapists are ready, they'll call you through to the treatment machine.
Are you able to show me the machine?
Yeah, sure. Let's go and have a look. So this is the treatment machine.
Gosh, it's huge.
Well, I guess it can be a bit intimidating for patients when they first see it, that's right. But most of the time, our patients get used to it fairly quickly. The first day of treatment generally takes a little bit longer than any of your subsequent treatment days, but generally about 10 to 15 minutes.
And how often do you need treatment?
Usually it would be anywhere from 1 to 6 or 7 weeks, every weekday barring the weekends and public holidays, of course. Once we've got you in the treatment bunker, we'll help you onto the bed here and we'll locate all those markings that were done in the sim and draw a few more lines on. We'll then line you up under the machine using the lasers and get you into position for your treatment. The lights will be dimmed to help us use those lasers. We'll turn them back on once we leave the room. The radiation therapists work in pairs, so they'll check off your details. They'll then exit the room to get the machine ready for treatment. They can keep an eye on you on the cameras that we have installed in here. and then they can also hear you via the microphone here as well if you have any concerns at all during your treatment. If you'd like, you're more than welcome to bring in your own music, and that might help you along during the course of your treatment. The machine will actually move around you and come quite close, but won't touch you at all. With the treatment itself, there's nothing to worry about. You don't feel anything and you don't see anything. You just hear the machine buzzing away, and all you need to do is stay nice and still and breathe normally. We'll do the rest.
I once heard someone ask if they would be radioactive after treatment and if that's bad to be around children.
Well, no, that's not the case at all, Tracy. No one's ever radioactive, and it's perfectly safe to handle children and give them a cuddle whenever you want to.
And what about side effects?
Certainly the side effects is something you'll need to keep an eye on yourself. If you let your radiation therapists or your radiation nurses know if you've got any concerns, they'll certainly help you out.
Thanks so much, Brad. You've been wonderful showing us around today.
Quite all right, Tracy, my pleasure.
Can you point me in the direction of the radiation therapy nurse?
Sure, come and I'll show you the consultation room.
Hello.
Hi Tracy, how are you?
Well, thanks. Carolyn's one of our radiation therapy nurses, and she'll see you after your first treatment. Isn't that right?
That's right, Tracy.
So, what happens during that first consultation?
Well, we like to see the patients for probably about half an hour of their time. We like to know what medications they're on, what food supplements they're on, any allergies that the patients may have, and it'd be a really good idea if the patients could bring a list of their medications in, because it's important for us to know what they're on, and any other significant medical illnesses that they may have prior to their cancer. Depending on where the patients are actually having their radiotherapy, depends on what kind of side effects are discussed.
Are there other support services you refer people to?
Oh yes, Tracy, we have a wonderful referral system here in the hospital, and we have, for an example, we have our nutrition department, which we have a dedicated dietitian here at the clinic, and they see the patients on their first day of treatment, and then we work out when they need to see them again, which is a very important service. We also have a pastoral care service, which is very, very beneficial for those patients that require that. We also have a social work department. We've got lots of people that help everyone. They're an invaluable part of our team here at the Holman Clinic.
How often do you see patients?
We see the patients every day if we need to, but ideally we see them once a Monday, just to ensure that they've had a good weekend and if there's anything they need. And then we actually have 3 radiotherapy nurses here full time, and our hours are 8:30 to 4:30. So if ever you need to see us, we're here, and you can also contact us on the phone. We'll give the patients our direct number on the first day of their treatment. And our receptionist is very good as well. She can always track us down.
And what about if you become unwell outside of clinic hours?
Well, we'd advise you to contact your GP, or if you could go to your nearest accident and emergency department.
Should patients bring a carer or family member with them for that first consultation?
I actually think it's really important that you bring a family member or a carer, someone that you feel comfortable with, because sometimes another pair of ears is of great benefit. I think everyone here just works as if the patients are a member of their own family, as in we treat you as if you are our mother, our father, or a brother or sister.
Thanks so much for your help, Carolyn.
It's a pleasure, Tracy.
Let's go to chemotherapy. That's where I work. Hi Sharon.
Hi Tracy.
This is the chemotherapy reception desk where you will arrive and check in for your treatment. All the reception staff throughout the clinic are a great resource if you require referral to any of the services available. When you arrive, you will be directed through to a treatment chair.
Hi, Trace.
Hi, Sarah. Sarah's one of my nursing colleagues. She's going to talk to us about what the clinic offers today.
Come through. Tracie, this is our lovely clinic, and this is one of our comfortable treatment chairs.
So, Sarah, what advice would you give people about what they should bring with them during their treatment in the Holman Clinic?
Okay, for your first treatment, it's really helpful if you can bring a list of medications, any supplements that you might be taking, and a record of any allergies that you have. Other than that, just bring yourself something to help pass the time.
And are you allowed to bring family, friends with you during your visit?
Sure. Family and friends can be really helpful because they ask some of the questions that you might forget and they absorb some of the information too. But as you can see, we haven't got a great deal of space, so not too many, and we prefer that you don't bring children.
So while people are having their treatment, they have a talk to the person next to them, have a read. What else can they do?
Sure, we try to be really sociable. Often patients talking to each other can be the best resource and really helpful. But otherwise, we're really relaxed. We've got TV, music, whatever you prefer at the time, and we like to have a good laugh.
And do people have to have a blood test before they have chemotherapy?
Yeah, definitely. Unless you're told otherwise, you always have to have a blood test before treatment, and this should be done on the day of your treatment or the day before your treatment.
And are you allowed to eat before you have chemo?
Of course, yep. Just carry on as normal. You can bring any food in that you like. We do offer drinks and snacks, and if you're here over lunchtime, we'll provide you with a light lunch.
Home was never like this. Lovely.
And how long do people generally stay for treatment?
Well, when you have your treatment, obviously you'll be in one of the treatment chairs. We put a drip in, we hook you up. Treatment can vary, anything from half an hour, 4 or 5 hours, the whole day.
Are you allowed to be around others when you're having chemotherapy?
Yeah, of course. Just carry on as normal.
And chemotherapy nurses have a lot of experience with dealing with the side effects of treatment, don't they?
Yeah, of course they do. And all the treatments are different, so it really depends on what treatment you're having as to what side effects you might expect. But not everyone will experience the same side effects as well. So we're always here to answer questions, and it's really important that you report any different symptoms or side effects that you might be experiencing.
What about if you become unwell?
Well, as you know, we're only a day clinic, so we're open 8 to 4:30. There's always someone on the end of the phone to answer any questions or provide advice. We can't offer an emergency service here in the clinic, but if you do become unwell, you must present to emergency, and especially after hours.
Do you give people a letter to present to the emergency department?
Yep. When you're here, we'll give you all the information that you need, and we do provide an emergency letter, and that's just got a record of what treatment you've had and what action should be taken if you do become unwell.
And what about keeping a relationship with your GP? Is it important for patients still to see their GP while they're on chemo?
Yeah, it's really good, and it's really helpful that they do keep a relationship with their GP, because the GP can often be the first port of call, can help with some of the side effects or just little problems that you might have. They like to know what's going on.
Do you have to be on a special diet when you're on chemotherapy?
No, again, it's just living like you normally would. So it's really important to keep up with good nutrition for energy and to help you through. But otherwise, it's just about eating what you enjoy. And if you do need a little bit of extra help, we've got dietitians here available.
So going for a walk, I guess, and getting some exercise, if that's what you normally do, is a good idea to keep that up?
Yeah, of course, exercise is really good because fatigue can be a bit of a problem, so it's good to keep up some exercise as well as getting out and about and doing things with friends that you normally would. You'll probably find that you can't manage what you used to be able to, but that's okay, that's normal.
Are you allowed to drive after you've had chemo?
Yep, there's no reason you can't, but we do recommend on your first treatment, it's probably a good idea to get someone to drive you home just to gauge how you feel.
What about hair loss?
Yeah, this is something that people worry about, but not everyone does lose their hair during chemo. It does depend on what treatment you're having. And we've got some great resources available, hats and scarves, and we can help you with a wig if you would like. Social work, we've got a great program available, Look Good, Feel Better. It's for men and women, and they all love it and really rave about it. It's really helpful.
Thanks so much, Sarah.
It's a pleasure, Tracy. When the patients come the first day, we're here to help. We offer support. Bring all the questions that you've got and we'll help you get through it all.
And I'm sure you'd keep that up through their whole treatment.
Of course.
Thanks, Sarah. Good morning, Dr. Sainer.
Hey, Trace. How are you going?
Well, thank you. I was wondering if you had some time to have a chat to us about what your role is here in Holman Clinic.
Sure, no problems.
So, can you tell us about what you do?
Well, I'm the palliative care physician. I'm one of the two palliative care physicians at the hospital, and I spend quite a lot of my time working in the Holman Clinic here. We do a lot of treatment for cancers in this unit, and we realise that treatment is not always curative, and so a lot of the management of issues that I'm involved with is looking after people who have got situations which we can't cure but who have symptoms who need looking after anyway, and so we're looking at the caring side of things rather than the curing side of things.
How do you help patients?
Well, I see a lot of patients with a number of symptoms, both physical, emotional, psychological, and I work as part of a complex team made up of social workers, nurses, occupational therapists, physiotherapists, pastoral workers, who look at all aspects of the patient, not only their physical environment, but also their family environment, their emotional environment.
So your primary focus is to provide ways for patients and families to make the most of their lives whilst being treated.
Yes, definitely. We look at improving the quality of life. That's really what we are aiming at. We look at the whole environment that the patient actually is living in, and we endeavour to get positive input from all aspects of that environment so that we can make this experience a positive one.
So how important is the role of carers and family?
Absolutely vital. I think without the carers and family, people would end up in hospitals, and that's not where they want to be. They want to be at home with their friends, with their families, doing the things that they normally do. And so what we hope to do is to set goals where people are able to achieve what they want to do.
So what's the best way to arrange a review with you?
I can be seen here at the Holman Clinic or in the community or in the hospital. I see patients in all those areas. We, in the palliative care service, take referrals from anybody who's connected to the patient. So we can get referrals from nursing staff, from doctors, from GPs, the staff here in the clinic.
Thank you so much for your time this morning. Have
Good.
a terrific weekend.
Good to see you. Thanks.
So today you've learnt about Holman Clinic, your treatment and the support services available to you. But most importantly, you've met some of the team who've been taking care of you during your treatment. Right?
Right.
Okay, back to work.